Mr. Speaker, this government is out of control. It has become too big and too intrusive. It is spending too much. It is taxing too much. It is regulating too much. It is borrowing too much. And it's sticking its ugly nose into our business too much. This must stop. Obamacare does every one of those things. This law is as disastrous as a train running full throttle without an engineer, speeding towards a head-on collision and wrecking everything in its tracks. I come before you today with a solution, My Patient Option Act, H.R. 2900. My Patient Option Act will revitalize American health care, not through government interference, but by giving the American people full control over their health care decisions. It will make health care cheaper for everyone. It provides coverage for all Americans, and it will save Medicare from going broke. My Patient Option Act repeals Obamacare in its entirety and replaces it with some patient-centered, common-sense solutions. These solutions include 100% tax deductibility for health care expenses for everyone, including insurance. Flexibility for individuals and businesses to join associations where there will be a smorgasbord of health care insurance options. Expanding health savings accounts that patients will own and control. Freedom for consumers to purchase health insurance across state lines. And tax incentives to reward physicians who provide free care to patients who cannot afford health insurance. My Patient Option Act accomplishes all of this and more in just 77 pages. That's a stark contrast to over 2,700-page regulatory nightmare of Obamacare. In fact, Obamacare's regulations are 2 million words longer than the Bible. Any bill that much longer than the Bible has to be bad for America. My Patient Option Act is the solution that Americans need and deserve. Unfortunately, the clock is ticking, and time has almost run out. A Georgia businessman recently told me that his insurance premiums for his employees have increased by 40% this year compared to last due to Obamacare. Another Georgia businessman, who is an owner of several fast food restaurants and currently employs over 200 full-time workers, recently told me that he is seriously considering letting them all go and hiring only part-time employees. And recently, even President Obama's Health and Human Services Department has admitted that you might not be able to keep your current doctor even if you want to. If Congress does not act soon, we will be hearing more and more of these same stories. I'm here to tell all Americans and all American families that it doesn't have to be this way. Mr. Speaker, if Americans want true patient-centered health care reform, then they must contact their congressmen and senators and urge them to pass My Patient Option Act. Mr. Speaker, if Americans want lower cost, coverage for everyone, and government out of the way of the doctor-patient relationship, then they must contact their representatives and urge them to pass My Patient Option Act. If Americans want full control of their coverage and freedom to make their own decisions in health care, then the Patient Option Act is the only true solution. We don't have much time, but through the voices of we the people, the American people, we can work to repeal this disastrous law and replace it with legislation that serves the best interest of my patients and all patients, not government. That's My Patient Option Act. Thank you, Mr. Speaker. I yield back.
Gentleman yields back.